Thank you to all of our attendees for being here today. We are thrilled to welcome you to the second anniversary of our series, as I mentioned. And we have today, of course, renowned pediatrician and global expert in tuberculosis and HIV research, Dr. Soumya Swaminathan. She recently served as WHO's chief scientist and previously as the Deputy Director General for programs at ICMR. After returning to India, she's assumed the role of the chairperson at the MS Swaminathan Research Foundation in February 2023. I'm sure you've all come across her work because for over 40 years of experience in clinical care and research, Dr. Swaminathan has dedicated her career to translating research into health programs, into impactful health programs. She has held a range of positions both at the government, at the government level. She's been a secretary to the Government of India for Health Research, the Director General for ICMR, and amongst other roles as well. Her efforts have focused on integrating science into health policy making, enhancing research capacities, and fostering global partnerships. Dr. Swaminathan has received her academic training in India, the UK, and the US, and she has authored nearly 500 peer-reviewed publications and chapters. She's a fellow of the National Academy of Medicine in the US and the UK, and many, many other honors that would be hard to, write out or speak about at this point. She serves on the boards of many organizations that serve a range of health issues, such as biodiversity, epidemic preparedness, population concerns, and other issues as well. I think most of us best know her perhaps as, or she came to our attention perhaps as, the WHO's first chief scientist, during which she established the science division focusing on research and quality assurance of norms and standards, and paid attention to the then rising issue of global health. She has, of course, played a pivotal role in coordinating global scientific efforts and was instrumental in setting up COVAX to ensure equitable vaccine distribution to LMICs during the COVID-19 pandemic. We are honored to have such a distinguished guest for our series, and welcome, Dr. Soumya. Just a quick note, we're following a slightly different format from our usual colloquiums. Instead of our talks, we are going to have a discussion. Dr. Soumya will have a discussion on the gender and health impacts of climate change with the director of our center, Professor Shreelata Seshadri. If you have any questions, I urge you to put them in the Q&A box at the bottom of the screen. And at the end of the discussion, we'll try to pick up a few of them for a Q&A session afterwards. Professor Shreelata, take it away.
Thank you, Abha, and thank you so much, Soumya, for being with us today. It's a real privilege to have this opportunity and for you to be on our program. You missed the introduction a little bit earlier, where Abha was talking about this being our second anniversary of this colloquium series. So we're very excited to have this conversation with you. And, we started this series in order to sort of seed conversations around issues of public health importance and to trigger discussion and ideas and so on. And we've had a range of topics all the way from, nutrition to gender-based violence to urbanization and so on and so on. And today we are, getting the opportunity to discuss a really important issue, which is, of course, climate change and its impact on health. And it seems to be a topic that is becoming more and more salient. You hear about it more and more. And so, and today's topic, navigating gender and equity challenges, in climate change and health. What made you pick that topic? You suggested it, and we were very excited to hear that topic. And I wondered what prompted you to pick a topic that was so close to our heart, coincidentally.
Yes, first of all, thank you so much, Shreelata and Abha, Gayatri, all the organizers of this colloquium. And it's indeed a pleasure to be with you all, though virtually, this afternoon. But I think it's great because virtual platforms also allow a lot of people to connect who otherwise may not be able to do so in a purely physical event. So to answer your question about why this topic, I've been kind of obsessed with this now over the last couple of years. And this is because during my work at the World Health Organization as chief scientist, I got a sort of a eagle's eye view of the determinants of health around the world because of, my involvement in research and data, and establishing norms and standards and really looking at the best possible ways to do that. It was important for me to really see, or I got a very good sense of the status of health, not just healthcare, but the status of health of populations in different parts of the world. I also got an opportunity to visit places, including like deep into the Congo rainforest during the Ebola outbreak, and in many parts of Africa as well as Asia. Of course, I've traveled extensively in India as well. And so it was clear that on the one side, we have the health system that a lot of us as health professionals tend to focus on. What are we delivering in terms of healthcare service delivery? And of course, we talk about universal health coverage, but what comes to our mind, I think most often is what services are we delivering? How well are we doing it? And are we doing it without the person having to incur catastrophic expenses? What we often overlook or forget or doesn't obviously jump in front as key are the social determinants. And to that, you can add now the environmental, ecological, economic, commercial, very importantly, determinants of health. And I realized over the past several years that our health is determined by these factors much more than it is determined by our access to health services, which we need when we fall sick. But everyone wants to stay healthy as long as possible. And that is determined by the air we breathe, the water, the housing, the nutritious diet, whether we get that or not, whether we have access to open spaces for exercise, what's our mental health like. And this is where climate comes in, because climate change is impacting all of these things. It's impacting it, of course, very visibly when we see the disasters, the big climatic disasters, floods, cyclones, prolonged heat waves, droughts, etc. But there's also the very real but under the radar change which is happening, which is impacting people now, right now, even as we speak, and which is not so well recognized. And even globally, when you think about the discussions at the COP, for example, we've had 28 COPs, and it was only in COP 28 that health was even given a platform, and agriculture for that matter. So it took 28 COPs for the world to recognize that climate change is about our health. And that if we don't start from that perspective, then there's no point talking about energy transitions and reducing, because we need to really look at it from where it is actually impacting us, and that is our health. And that is very, very urgent. And while we need to keep doing mitigation, what is not had the attention is the adaptation and the resilience building, and the financing is completely disproportionate. So first of all, there's very inadequate financing globally to support low and middle income countries. But even what financing there is completely focused on mitigation. And there's very little going to really adaptation to addressing the health impacts. And finally, let me conclude by saying that all of this came together when I was asked by the Minister of Women and Child Development to look at the impact of climate change on women and children in India. And when we started doing that work, we did it fairly rapidly over a period of 6 to 8 months. But not only did we do reviews of the literature, but we connected with a lot of NGOs working on the ground, of course, also government officials. But we tried to do regional workshops involving a lot of women's groups in particular. And we heard resounding cries for help. We heard from the ground how this is impacting, particularly women, how things are getting worse from year to year. And the fact that this report is now being received almost uniformly welcomed, both by government and by NGOs, saying that, okay, in one place now we have the data from India, which has opened our eyes to many things. Of course, there are still gaps in knowledge where more research is needed. But even with existing information and experience, we know where we need to act and act urgently. So that has now become my mission.
Thanks. And actually, the last part of what you said kind of leads me to the next question, which is, of course, India's facing, I think, brutal impacts of climate change. And, you spoke about this research effort and pulling together the experiences and data. Do you think that we have the metrics? Do we have the, other indicators by which we measure the impact of climate change, whether it is heat or erratic rainfall or, any other impact that might be affecting health? Do you think those are sensitive enough? And where do you think we could do better? And do these indicators actually pick up the kinds of impacts on health which we may not know entirely, what the extent of that is?
That's an excellent question, Shreelata. And it's really, I think you've hit the nail on the head, because this whole dialogue around climate is being led by climate scientists. So very often, are geologists or physicists or people in the Met department and so on, meteorologists. And so when we actually started looking at these things, you're absolutely right. For example, the definition of a heat wave is, going above a certain temperature for 3 days in a row. Now, that temperature cutoff, I would say, has been decided by some process, fairly arbitrary. Because if you are somebody who's living in a coastal city like I am in Chennai, then a temperature of 40, if you actually look at adding the humidity factor and what we call the wet bulb temperature, you have to add at least 5 degrees to it. So if you're measuring only temperature is 40, but actually my body is experiencing it at 45 or 46. If I'm a poor woman who's living in a tin roof hut, the internal temperature is actually 5 degrees more than what it is outside. So add another 5 degrees, and if I'm somebody who's used to living in Ladakh at a temperature of 20, that's what my body is adapted to, then 35, prolonged at 35 is actually a heat wave for me. So I think the Met Department, the IMDs also now recognize the fact that, and the Disaster Management Authority as well, because we've spoken with both of them, that this definition of a heat wave is inadequate, and it needs to be modified based on the biological impacts. And that's where your vulnerabilities come in. So on the one side, you have the climate or hazard. On the other side, you have the exposure, which also depends on, are you an outdoor worker? Do you have access to air conditioning? What do you do? So what type of exposures are you facing? Where do you live, etc.? And the third is vulnerabilities. So the vulnerabilities, again, depends on your occupation, your age, your sex, your gender, your place of residence, the type of housing, access to services, and so on. So I think it's a very, actually needs to be much more sophisticated and contextualized, these definitions. And I think we have at the moment very high level kind of definitions and plans. We have to get much more granular. For example, a city. Yes, a city could have a flood. Not everybody is impacted. We always see that, right? In any city, when you have a flood, who are the people most impacted? They are actually the lowest income people who are living on the edges, the low-lying areas in slums, etc. Heat wave, who will be most affected? Again, the people who are living in these low-cost housing, which don't have air conditioning, which don't have good ventilation, and where people have to work outdoors to earn a living. So I think city governments have to take cognizance of this when they actually make their plans of how they're going to mitigate and adapt these hazards. And this is why now we, with a few other groups, are coming together to really put in place a system to firstly do the research and measure the biological impacts of heat across genders and age groups and occupations, and then to come up with solutions, which many of them could be, the solutions could come from the communities themselves. After all, our traditional knowledge, we've known how to handle heat and so on. But it's in this urbanized world where we're living in, where, that traditional knowledge has not been taken into account while we build our cities and our peri-urban areas in particular, where the risk has really gone up a lot. And so it's going to require, of course, a multi-sectoral and all of government approach. But I think the fundamental understanding of the impact on people also has to be brought out much more clearly by academics and researchers.
I think one of the things also a very important impact is also on mental health. And yes. I wonder whether you, in the report, you've had a chance to address that as well, and whether there are groups that are looking at that.
Yeah, great question. There's a lack of data. So we tried to contact all the mental health experts we could find. And while there's a lot of anecdotal evidence and evidence from studies in the past showing that, your mental health is determined by the kind of environment you live in. And also a lot of studies that have looked at post-traumatic stress. So for example, if you've been hit, by a cyclone, or you've been displaced by a flood, obviously there is a post-traumatic stress, and there is a lot of things which happen after an acute event, including increased gender-based violence in the camps, if you're all displaced and you have to live in a camp and so on. So there is documentation of that. What there's much less attention to is, again, the longer term, more chronic, more subtle effects of the impact of climate, whether it's repeated droughts. For example, we found when we did an analysis of the NFHS data that takes the health indicators, and we superimposed it on the districts, divided them into those which have been facing recurrent droughts over the last 10 years and those which have not. And when you compare some of we looked specifically at women and children, underweight was higher in women, so was younger age at marriage, earlier pregnancies, and the incidence of domestic violence, intimate partner violence, tremendously increased, decreased access to immunizations and routine health services. So you can see that when people are faced, and these were all people who had faced recurrent droughts in the last 10 years, that it impacts the health of both, women and children. Certainly mental health, there needs to be much more in-depth work done to really uncover, but I think everyone agrees that there's a huge impact on mental health. For example, surveys that are being done globally are showing that the levels of anxiety and depression, particularly among young people today, is much, much higher than what it was historically, and is higher than what it is in other age groups. And 18 to 25 used to be the age group with the best, the most optimistic outlook on life. But today it's not. And that could be a result of the pandemic and all the uncertainties, plus the climate change and the fact that, of course, the world is also going through a lot of conflict and economic recession in many parts of the world. So these are very worrying signs that, that we're seeing. The projections, I've seen some modeling that's been done for the US and Mexico, with a very strong correlation between the temperature increase and the incidence of suicides. And again, heat is not well recognized at all, that if you're living with a mental health disorder, if you're taking psychotropic drugs for depression or some serious mental disorder, then you are much more likely, because those drugs are actually making you less adaptable to heat. So it works in both ways. If you're already on psychotropic drugs, you tolerate heat less well. And similarly, even if you're not, exposure to heat increases the chances of your developing a significant mental health disorder, to the point where suicide rates actually go up during the very peak hot days.
That's very alarming. One of the things that we found in some of our work is that people actually lack the vocabulary to speak about what, either heat or any of these other climate-related impacts. You can, how to express if you have, a fever, or you have dengue, or, any of these things. You can describe your symptoms and you have words for it. But, I think this kind of thing impacts people in ways which they haven't learned how to express that yet. And I think that's something that that is worth looking into as well as we go forward.
Correct.
As we progress. In the topic that we're talking about today, in fact, you've said navigating gender and equity considerations. And of course, now it's increasingly being recognized that gender is a very significant issue because women tend to bear the brunt of, climate impacts, whether it is in the case of, natural disasters, whether it is in changing agroecology, etc. I know that your foundation is doing quite a lot of work in this area and looking at, especially in the context of the feminization of agriculture, etc. You've been looking at, climate change and how it impacts women farmers and so on. I'm wondering how you're integrating gender concerns into the work that you're doing.
Thank you, Shreelata. I think the MS Swaminathan Research Foundation from the very outset was very aware of both these issues, the feminization of agriculture, and particularly when you look at smallholding agriculturists, you'll find that it's mostly women who work in the field, and this is unpaid labor, so they're not even counted as being part of the labor force. And more with migration of men to the cities, again, partly driven by climate change and the lack of opportunities in rural areas, women are being left behind to look after the home, the farm, the children, and to somehow, ensure that their family is taken care of and so on. So there's a huge increase on the burden of work on women as well as drudgery. Water, we know, is one of the key issues, declining water availability, water table in many parts of the country. And women are having to, go further to collect water, spend more time. And similarly with firewood as well. If you go to any of the rural areas, you'll see women still going into the forest to collect firewood. Despite all the efforts, that have been made through the Ujjwala scheme, etc., to get LPG connections to poor women, they still use solid biomass for a significant proportion of their needs. So what the foundation has done really is to focus on the needs of women farmers and starting, basic things like the land is hardly ever in the woman's name. And even if the husband dies, it's very difficult for her to get hold of. And if she doesn't have land in her name, she also doesn't have access to finances, to loans and credit and things like that. Secondly, the whole agriculture has been basically a male-driven occupation, and even people who work on it have not really considered the needs of a woman in terms of agricultural equipment and so on. So we've also worked with engineers and so on to design more woman-friendly equipments. If you take millets, particularly the minor millets, which are again traditionally a crop that women have tended to because they tend to occur in the drier areas, in the upland areas and so on, in small farmers' fields, then the processing for minor millets again has not been something that has received attention, and therefore you'll still find women having to hand pound millets, and therefore the production and the consumption of millets has gone down significantly over the last 40-50 years in India. The land under cultivation, if you see, has come down so much. Slightly now after this International Year of Millets, that's more awareness has come. So we've also trained women farmers in new technologies and using digital tools way before there was internet or mobile phones. Using satellite-based technologies, we have village knowledge centers and village resource centers, which are run entirely by women. They just 10th class pass basically, but they take to technology so well. And now we're working, of course, now there are mobile phones, apps and things like that. So now we're working with fisher women, for example, to digitally equip them with the kind of information that they need, which can be available to them on their phones, so that they get a good price. They know where to go to market their fish. They can be connected with vendors, they can do online sales, etc. So really building up their both their financial and their digital capacities. And you don't have to be even literate. People can actually use phones even when they're not literate to make an app and so on for them. And nowadays you can use voice chats and so on. Similarly, now on the agriculture side, we've trained a whole cadre of women who run what are called plant clinics that are able to diagnose common pests and pathogens and give advice to farmers. So it also gives them a livelihood because they can charge something for their services, and at the same time, it's enabling better farming practices. There are now many women farmer producing organizations. And of course, self-help group movement has grown a lot. So I think there is a lot of potential. What we need to do is to recognize that these women firstly have traditional knowledge, wisdom. They don't need to be spoken down to. They don't need to be treated as people who don't know and are dependent on us academics to come and tell them what to do. And at every conference that we have at MSSRF, we always have several participants who come from the community, either it's fisherwomen or fishermen as well as farmers, men and women, and they make the most relevant points. I feel, in every session, after all the academics have spoken, there'll be one woman who will speak for 5 minutes and she will capture exactly what the challenge is for them. And very often it's access to information and knowledge. There are thousands of government schemes, but they're not aware of that. And so I think women certainly are always the frontline responders. If you look at our health system also, majority of workers at the community level are women, and yet their capacity has not been built to deal with climate-related diseases, and neither have their own needs been looked at. And so one of the case studies we found was on the heat action plan of different cities, and how they recognized that when the maternity ward was located on the top floor of hospitals, there was a higher neonatal mortality. And so when they moved the ward to a cooler part of the hospital, that came down. So I think we really have to, all of us, think very differently now, because we're not used to this type of thinking about this type of impact. And I think women, both in terms of the workforce as well as in terms of being impacted disproportionately, I think clearly stand out as a group that needs needs more focus.
Do you work largely in Tamil Nadu or also in other states?
We work across many states. We have our regional centers in about 3 states. So in Orissa, we work in the Koraput tribal district, in Kerala and Wayanad. So these are both our community agrobiodiversity centers. As you know, these are both biodiversity hotspots. We also work across tribal areas in Tamil Nadu. And then we have a Fish for All Research and Training Center in Pumpuhar, which is in Nagapattinam district of Tamil Nadu. Apart from that, we've worked on the coastal areas in Andhra Pradesh, Orissa, as well as West Bengal. And we're doing some work in Madhya Pradesh and Assam, again, on climate resilient agriculture and partnership with other organizations.
Do you find in your work that there are some very clear sort of contextual factors which support or inhibit uptake of some of your programs? I mean, I know broadly, of course, you would see that, but particularly in terms of climate related health impacts, is there greater awareness or readiness to be able to come to terms or to be able to address these issues? And what could some of those factors be?
So do you mean in states, different states in India?
Yeah, in different states, are there contextually some, some inhibiting or supporting factors?
Yeah, that's quite an interesting question, because one of the things we did look at in our report was the state action plans on climate change and health. As you know, there's a national action plan on climate change and health, and there are state action plans. There's also heat action plans, which every state develops, and so on. And most states have, developed these plans. They've done a good job, but that's where it ends. It ends with that plan. And while the word gender, is mentioned in the National Action Plan on Climate Change and Health, and some states have mentioned it, there are very few reports which actually operationalize what do you mean by, a gender transformative plan. That is not really, this is work that's been done by Chandani Singh and colleagues at the Indian Institute of Human Settlements. Now, this was done a few years ago, and now, of course, states are revising there. But what we recognized as through our work is that even state governments are they're struggling with what should they really do to make their plans gender transformative. So that's one, looking for the ideas. And there are a few states that are ahead of others, and we can learn from them. The second, I think, is really both the coordination, the governance, and the financing of these plans. Because if there is if that is not laid out well, how will it be financed? Who will coordinate it? Who's responsible? And what are the actions that each department has to do? Because clearly there are actions in every department, not just health.
Yeah.
That's where the challenge comes, because there isn't that financing. So the recommendation that we are making in our report is that this type of climate adaptation has to happen at the local level. Not even at the state, not even at the district. You have to go much lower than that, because it is so contextual. And it is the panchayats, the local bodies, that must be empowered. Of course, they don't have the capacity right now. So it means a lot of capacity building. It also means giving them the resources. So I hope that the next Finance Commission will actually devolve more resources to local bodies. You see how Kerala is probably the only state that has that type of decentralized system where the panchayats have a lot of power. And I'm not so sure about climate, but certainly if you look at something like palliative care, which is also a very neglected space, which needs much more work, you'll find that Kerala has a beautiful model of palliative care that's owned by communities and by the panchayats. And that is, I think, the only sustainable way forward. The top-down approach really, stops working at a particular point, because what's happening at the local level is not matching with what one is being told to do. So I think whether it's pandemics and what action you take, because again, a pandemic has to begin and end in a community. It doesn't just come out of the air. It begins somewhere. And so action has to be there to stop an outbreak becoming an epidemic, and an epidemic becoming a pandemic. And again, you see Kerala, responding to Nipah, with this last few years that they've had these exposures. Now they're able to contain it with 1 case, 2 cases. It doesn't really become a big outbreak. So that's the kind of thing we need to start doing for climate as well. And obviously it's going to be, there are maps of India now showing which are the most climate vulnerable districts. But practically every district in India is exposed now to some climate extreme or the other. So I don't think anyone is spared. Some are already much more badly affected than others. So I think the challenge before us is community engagement, developing these plans locally, and then being able to finance them, and then having some model of oversight and governance and so on.
I think that's absolutely correct, that local ownership, local action is the way to go. But one of the big players, obviously, in the response will have to be the health system as well.
Yes.
And I was wondering whether, in your experience, and you've been, of course, all over the globe, whether you've encountered, anywhere where they've done a really good job of gearing up the health system, and what would be some of the low-hanging fruit that perhaps we could adopt here in India, and try and make them scale them up at a national level.
Yeah, that's an interesting question. I think I'm sure there are good examples in India as well as in other countries.
Sure.
Small models that are working well. For example, in the Sundarbans, where, these islands often get cut off during the monsoon and so on, you have these health centers which basically run on boats.
Yes.
And they go from island to island providing health services. So I think the immunization program is one of those which has done a lot of innovation we can probably learn from in terms of even supply chain management and so on. Come what may, the vaccinations happen even when everything else suffers. And so they have over the years built that capacity and a huge network of people, as well as the electronic ways, digital ways of tracking and monitoring what is happening to the last mile. So we can actually track the vaccine, the temperature at which it is being transported, and so on. So I think that's the kind of thing probably in the supply chain that we will need to build and innovate on. And then depending on what kind of climatic stress you're going to be exposed to, you have to obviously innovate. I talked about the health centers, trying to locate their vulnerable populations in places where they're not going to get exposed to very heavy heat, for example, or setting up cooling centers. Similarly, I think having training and constant upgradation of skills for the health workforce. How do you recognize somebody who might have an early heat stroke and treat them? In the community, we've seen things like cool roofs, where you can paint the roofs, with that reflective paint. And then, of course, there's a big movement now to making health facilities green, which means that you go towards renewable energy. The added advantage of that, apart from reducing carbon emission, of course, is that you have your electricity on throughout, because you're not dependent on the coming from somewhere else. You're actually generating it. And in many health centers around the world, in fact, WHO says 50% of healthcare centers around the world do not have electricity and running water, 24 hours a day. And those are two very basic things you would expect every health center to have. So, and then, I think planning for where are your health centers going to be located, because very often you see that if there's a flood or a thing, the health center is also affected and has to be shut down. So then it really doesn't help the community. So if you're in a flood prone area, I've seen in Africa, for example, somewhere where they built this health center in a location where people can normally come by road or by walk or by cycle. And during the monsoon, you can actually come there by boat, because the area in front of it actually becomes a river. And so actually thought about the location of your health center so that it's accessible in all seasons, to people. So I think it's that kind of reimagining that has to be done. And there are few good examples, but I don't think it's really being applied across the board.
Also, I suppose the capacitating of the community health workers to be able to recognize some of the symptoms of,
Exactly.
the heat stress or other mental health issues, other kinds of stress that might be impacting the community.
Yes.
I think that process also perhaps hasn't started, and it would be interesting to figure out how to plan for that and how to design such a program.
Correct. Absolutely. Yes.
There's a lot of activity on chat, I can see, but I'm tempted to ask one last question before opening it up to everybody else, which is actually going back to one of your previous roles, which was as the sort of COVID-19 the leader, thought leader, and otherwise, so deeply engaged in managing the COVID-19 pandemic. And alongside, there was a lot of this conversation around One Health also, obviously, because of the, the zoonosis and all those kinds of risks. And I'm wondering whether the conversation, the One Health conversations, have they been sensitive enough to gender and inequality? Have they been, responsive to, the differences and vulnerabilities and risk exposures, etc.? Is there something else? Is there something more that could be done in your experience?
Short answer is yes. I think there's a lot more that can be done. And I don't think that the One Health thinking has really encompassed this because it's been focused very much on disease surveillance and in humans, in animals, in the environment, and on things like antimicrobial resistance. And I haven't seen much really in the literature where these intersectionalities are really considered. But it's absolutely, I think, clear that the people who are most impacted, again, are those, who are marginalized, the tribal communities or people who live near forests, certainly have a higher risk of being exposed, not just to diseases, but even to, more conflict with wild animals. And then there's the whole issue of food safety and, of course, antibiotics present in the environment, but also contaminants, pathogens, and so on, which are coming into the food chain, and to humans. So there are many aspects of One Health. I think we're just beginning to scratch the surface. And because of the fear of the pandemic, there's a lot of attention being paid. Let's build more labs, let's set up more labs and let's do more surveillance, which is good. But again, the human and the animal and environmental surveillance really have to come together and speak to each other and share data. Otherwise, it's really of no use having all that data sitting in silos. Even recently, a few days ago, there's, read the newspapers about an outbreak of an unknown outbreak caused by an unknown pathogen in Gujarat, where people have actually died. And we still don't seem to have a pathogen identified. So these things are going to keep happening more and more frequently. And therefore, the sooner we set up these systems, the better. But yes, with respect to your question, I think it's important that we start talking about that in the context of One Health as well.
Thank you so much. I'm going to actually stop now because there are too many questions here and I don't want people to feel like that they haven't had a chance to participate. I'm going to ask Abha to moderate this next few minutes of that we have left. Abha, perhaps you can, the most, I think there are probably clusters of questions. So if you could perhaps put them together for Soumya.
Yes, absolutely. Thank you so much. That was a great discussion, and I felt like I could have kept listening to it for a long time. But I think we have a lot of attendees, and I think a lot of them have questions, so we should get to that then. We have Harita asks, what do you think is the most significant barrier to achieving gender equity in climate change policy and action? I think you mentioned how when the foundation has events, you ensure that these voices are heard, but in a more broader sense, how do we ensure that this happens and what are the barriers to it happening?
So I think, to my mind, the way it can happen is the two ways. I think one is, of course, like I said, decentralization of responsibilities as well as of financing to the local bodies, where these things automatically will find their way to because panchayats now, you have good women's representation and so on. So these issues hopefully will surface and will need to be addressed. And we're doing a lot of work on water management with panchayats, and we know that that's really having very good results. Second, I think, is when government budgeting and planning is done. There is this term gender-based budgeting, but if you really look at what's happened, it hasn't had the kind of impact I think it was meant to have. And so I think really finding a way of operationalizing gender-based budgeting across every ministry and department of government, where they have to look at issues and they have to have outcomes and they have to have way of monitoring. And part of it is data. Again, I think throwing light. So that's why I think our report was received and welcome, because it just threw the light and say, oh my God, this is a huge problem and we really hadn't recognized it as such. So I think we need all of that. We need the researchers and academics throwing
Has
Has Soumya frozen?
yeah, I think so.
Um,
How do we?
okay.
Let me try calling her 1 second. Seemed like it was going all right. Looks like are you back, Dr. Soumya?
So sorry, I seem to
Okay,
have got, yeah, cut
no.
off. Yes,
Okay.
sorry. So I don't know when I got cut off, but I
No,
was
no, no.
saying,
I think we got most of your answer there. So, okay, that's good. Thank you so much. And all right. Cheryl asks what, I think we've spoken a bit about the sort of obvious climate change consequences, droughts or floods and, heat stress and so on. Is there something going on more subtly under the surface that's being experienced by large numbers of people? Like even us sitting here in Bangalore, for instance, we've not experienced these extreme weather events that we hear about in Kerala or in Uttar Pradesh and so on. But what else is going on that you've observed on the field?
I think a lot is going on and it's under the radar. For example, the nutritional content of the grains, there is some data now to show that it's been declining, and especially in terms of micronutrient content. And that's because may not be climate change, but it's certainly the quality of the soil, which has been getting, deteriorating over the years. Similarly, like I said earlier, the impacts of more slow onset, climatic changes, like gradually, some landscapes are changing. And year after year, the rainfall is unpredictable or it's very delayed or they can't plant their crops on time. So all that is really leading on to food and nutrition insecurity, which is going to be one of the big impacts of climate change and which we really need to be addressing again through our climate resilient agricultural technologies. And the other one is things like repeated exposure to floods and drought. What does it do to your mental and your physical health? That's much less researched than the immediate impacts of a big climatic hazard. So I think there are data gaps in these areas, particularly as was Shreelata was talking about earlier on mental health. That, of course, impacts everything, right? Your productivity and your livelihood and all of that. So we're just about to do a study actually on a representative sample of women across India to look at the impact of heat over the last year or so to see how did it impact them in terms of their health, but also in terms of their income, their food during that time, whether the children could go to school and mental health, domestic violence, all of these areas is something we would like to explore, but there's lots of scope for research here.
Absolutely. I think it's a key point that you made, which is that, we used to think about droughts or floods as a, once in a lifetime event or an occasional event, but these are, now they're happening frequently. And people are experiencing them over and over again in a very limited span of time. So absolutely. Dr. Manu asks, how can we better incorporate technology and data analysis into the health system for more efficient healthcare delivery?
I don't have a good answer for that, except to agree that we need to do it much better. And we need to move away from the siloed systems to having a good way of looking at analyzing and using data, especially at the local level. I feel really bad when I see these women, Ashas and ANMs and Anganwadi workers filling up register after register. They collect so much data. Very little of that actually translates back into any feedback to them on how they can do their jobs better. Today, with the digital public infrastructure that India has, I believe that there's a lot of potential actually to use it to improve our healthcare delivery and to upskill our workforce. But that's a whole area of work that needs to be done. So again, yes, an area where people can work if they're interested.
I feel like the short answer to all of your questions is that we need to do more research to understand.
Yes.
I think
implementation research, I would say. Implementation research in a way that it can then be scaled.
Yes, yes. I think we've spoken a little bit about how, the research that we've done, we've looked at gendered impacts. So how do women experience it, like, say, in terms of agriculturization, the impact of climate change on agriculture, for instance. How about impacts that are specifically, focused on women? So, for instance, when it comes to maternal health or neonatal health, I think somebody in the chat had pointed out that there's a link between increasing heat levels and neonatal mortality.
Yes.
So are there any other such specific findings that you can point to, maternity care, maternal health outcomes, and so on?
There is recent work, again, emerging research now coming out of India, where pregnant women have been followed up in a cohort, and their outcomes in terms of pregnancy outcomes, of course, newborn weights, and have been looked at. And both heat and air pollution have been found to have negative impacts. So heat has been found to have increased incidence of stillbirths and abortions, but also premature deliveries. And the same with air pollution. In fact, it's even more dangerous because it leads to impacts on cognitive development of the children. Air pollution definitely has a much bigger impact on young babies and young children. And so large parts of India that are, right now with very poor air quality, almost throughout the year, we're actually exposing our women, and women, of course, double the exposure because still using biomass very often for cooking. And so you're exposed to indoor air pollution at very close proximity, and the outdoor. One contributes to the other. And very often the mother will have young children with her when she's doing the cooking. And so this is a real high priority as far as I'm concerned, but also low-hanging fruit. And by solving the problem of cooking fuel, giving all women access to clean cooking fuel, we can significantly reduce the burden of ill health due to air pollution on women and young children.
Absolutely. Dr. Raju asks, I think this is with reference to a point that you made earlier about how, the nutritional quality of food has declined over time. And what are the long-term impacts of this, not just for nutrition, but I mean, it's going to have spillover effects into all sorts of other developmental concerns as well, right?
Sorry, could you just repeat that?
No, I think you'd mentioned that as heat has increased, nutritional soil quality has declined and the nutritional quality of food has declined. What are the spillover effects of this? Dr. Raju asks. Not just for nutrition, but other kinds of developmental concerns as well.
So I think diet quality today is the biggest risk factor for health. If you really look at the analysis that's coming out of IHME, globally, inadequate diet is the biggest risk factor. It doesn't mean that it is inadequate in quantity, but really in quality. And we've seen from the latest household expenditure surveys as well that the consumption of processed food has been increasing tremendously, both in rural and urban areas. And we're actually going away from our traditional diets, which were much more healthy. And so that has an impact on everything. I think it has an impact on your immune status. It has an impact on incidence of non-communicable diseases, etc. So it will also have an impact on animal health, and therefore, through that cycle also on human health. So I think the impacts are very broad, hard maybe sometimes to put a cause and effect. So climate change is one of those things where it's very hard to put a cause and effect. And in fact, I just want to also mention that sometimes one can hide behind climate change. Actually, it could be even an excuse for somebody to not do something right, because then you can say, well, it's climate change and it really wasn't our fault. And so what I'm alluding to is model of development that we choose now today has to consider, this unpredictability of the climate and the weather. And we cannot take for granted, like we did in the past, that, okay, let's build here because maybe once in 100 years we have some problem, but the rest of the time we'll be okay. That is no longer the case. Every 3 to 5 years or 10 years, you're going to have a massive flood or a cyclone or whatever. And so I think that while climate change today is, I think, impacting all aspects of our life. And it's really almost impossible to list them all out. What is less hard, I mean, less easy to quantify is a cause and effect relation, direct cause and effect. For some things you can do. Vector-borne diseases are increasing, and we know that that's because mosquitoes can now survive in places where they couldn't earlier because the temperatures are more suitable for them now. But why is dengue increasing so much? It's not only the climate, it's also the way we've urbanized and the fact that the mosquito now finds it very convenient to breed in our cities because we're just providing it the right kind of habitat. So I think it's a combination of what we're doing, and that's why I think the word anthropogenic is perfect. We not only created conditions for global warming, but we're also adding to that through some of our other interventions, knowingly or unknowingly.
I think that's a really key point that you made. Sometimes we talk about climate change having a direct impact on health, but as you said, climate change can drive other things like urbanization, for instance, which have their own pathways to certain health outcomes and so on. And I think there are so many of these that we can probably tease apart in the coming years. It's not just a question of increasing heat and therefore some health impact resulting from that. Anup asks, does climate resilience health system development also include low carbon health systems? And shouldn't the first priority in countries like India be to tackle climate related health emergencies in the first place, rather than decarbonizing a health system, focusing on decarbonizing a health system which is not yet fully efficient?
I totally agree. I agree with that. The only thing I would say is that if you have an opportunity to put in renewable energy, for example, let's say you're building a new health facility and you're designing it from scratch, or you're upgrading something, then make it climate resilient, when you're building it. And that's of course also renewable energy, but the other design features also of climate resilience. So I think engineers now also have a lot to do and to learn and to adapt, because you need to start thinking about building standards which are appropriate for the kind of climatic zone that you're in. We cannot just take building standards from some Western city and say we're going to build. That's what we've been doing. So I think, so there's an opportunity to decarbonize, but I totally agree that that cannot be our main focus. I think adaptation and attending to people suffering today from climate-related health issues is much more urgent, and that's where our if you have a limited pot of finances, then that's where it should go.
Absolutely. Can you speak a little bit more about, I think we were just talking about urbanization, but can you speak a little bit more about urban heat islands and its health impact, specifically with respect to women and children? This is a question from Chinu.
So again, we have to make the connection. It's not like there have been a lot of studies to actually prove that women and children living in these urban heat islands are suffering. But you can put two and two together. And there has been work to show that you can reduce urban heat island effects by certain interventions like green and blue spaces and so on. And there are also other studies like longitudinal cohort studies, which have shown that people who live next to green and blue spaces have better physical and mental health. And certainly to reduce, like I mentioned earlier, if you're a low-income family living under an asbestos sheet or some very poorly ventilated setting, definitely you are going to suffer from bigger health impact of heat than if you're living in a more comfortably well-designed house. So, so I think that the data is currently being generated, but I think that if you apply logic, then it certainly you can certainly make the case for this kind of vulnerabilities that certain groups and communities are suffering from, and the need to take action. Shouldn't be waiting, for lots of research to demonstrate that this is happening. In fact, one of the issues has been that our cause of death data has not been of high quality, and it is only recently that a few papers have come out that have looked at cause of death and found excess mortality in the months where there has been the temperatures have gone above normal, and this was one study done across 10 cities in India, very well documented and well researched. So we need more good data, basic birth, death, and cause of death data. And cause of death data can give us so much information about the disease burden of the community and help policymakers actually make the right decisions. But in the absence of that, then you have to depend on modeling and things like that, which is certainly not as useful. So there's no doubt that there's excess mortality that occurs during heat, but exactly to quantify it, I think we need to look for better data.
And to better understand the pathways to that mortality.
Yes, exactly. And then also look at gender and age differences and things like that.
We have a couple of questions which are not strictly about climate change, but I think are related to some of the concerns that we've been speaking about. Shashikala asks about your thoughts on, on the use of pesticides in rural India, and Mohammed asks about the usage of plastics in urban India. And I feel like these are also related in some ways. Would you be able to speak to some of these concerns as well?
So I think we're going very broad now. So
okay.
Yeah. So I think let's
okay.
not. Yeah.
Okay. I think then perhaps there's a lot of other questions, but I think you've gotten to some of them. A lot of them are around resilience strategies and climate adaptation strategies, and how do you ensure gender equity and gender justice and so on. And I think you've spoken to some of these issues. I'm going to bring up to conclude a question that Dr. Gayatri, who's here, and we've spoken about this a bit at our center, is about how multi-sectoral the response has to be, right? It can't just be from a health systems response. It has to involve the departments of labor and education and industry and animal husbandry and agriculture and so on and so forth. What kind of response would you envision here? And how would one go about building this kind of multi-sectoral response to the impact of climate change?
So I think I mentioned earlier that the only way to do that would be for a complete rethink of how we're looking at climate change now, not just focusing on meeting certain mitigation targets that have been globally set, or what are called the nationally determined contributions, the NDCs, which now have to be updated by all countries. So those are things which are agreed at COP, and all countries have to fulfill them and so on. So there's been a lot of focus, and India has taken a lead also in especially in the energy transition, transport, and so on, solar expansion of renewable energy, and but the same sort of approach now for adaptation. And again, that is something now globally that's being requested, right? So for the first time, again, last year, countries agreed that we have to set targets for adaptation. There's got to be financing and so on. Financing needs are going to be very huge, actually, in trillions of dollars. And one thing we have to accept is that that's not going to come from somewhere. It's unlikely that we're going to get that. So governments will have to, and of course, private sector needs to play a role as well. So I think nationally, we need to think that what are our adaptation goals and our priorities across all these sectors that we talked about, and how do we actually use our own financing, the way government spends money today, and whatever development finance we get, how do we restructure it to ensure that we are actually moving towards synergies between climate and sustainable development goals. So we have to minimize the trade-offs and increase the synergies. So it's going to require a whole new approach and a framework to do that. So many things, we'll continue to do. Of course, development has to continue. We still have so many poor people. So we have to live, keep doing that. Food and nutrition security, health security, all that. But how do we do it in a way that we're also ensuring that every step we take today, we're actually enhancing and building climate resilience and adaptation. We're not making ourselves more vulnerable.
Thank you. I think that's a great concluding question. I'm sure there's other people who have other questions, and I hope they'll have a chance to have conversations with you and others at the foundation later on. But thank you, Dr. Soumya. I'm going to hand it back to Professor Shreelata here.
Thank you, Soumya, for such a wonderful session. And I think all of us learned a lot. I think your call to not shift the focus, but also start looking at adaptation and not just focusing on mitigation. I think that's something that that needs a great deal of attention. And in order to do that effectively, to do the kind of research into the data, the norms and standards that you had called for right at the beginning when we started our conversation, I think that's a critical piece that needs a lot more attention. And of course, where are the funds going to come from? And, this whole idea that we need to go down to communities and speak to them, get that contextual and granular understanding of what climate is really doing to people's lives, and how to co-develop perhaps interventions and initiatives that gives people voice and also ensures perhaps sustainability of those interventions. I think that's a really important point that came out in today's conversation. I thank you very much and really appreciate your taking the time. I know that you're run off your feet, and so we doubly appreciate your being with us and making our second anniversary something that's truly memorable. Thank you so much, Soumya.
Thank you, Shreelata. It was a pleasure.